Wisconsin's Joint Finance Committee chairs have identified that we will be pulling a number of health-related items out of the biennial budget. Governor Evers identified a number of healthcare priorities for 2019 through 2021. That was his proposed budget. It included priorities of coverage, access to healthcare, and innovation. But the Joint Finance Committee chairs conducted briefings, they held public testimony, and then they issued a memo on May 1st that said, we're going to pull a number of items from this budget. In it were the big items identified by Governor Evers as his top priorities, including Medicaid expansion, medicinal marijuana, and an issue important to us, eliminating the practice of birth cost recovery. These were big healthcare issues in the budget, and they were all pulled out by the Joint Finance Committee. In all, about 131 items and provisions were pulled out of the budget. Not all healthcare. They crossed the board for agency budget items that were identified as priorities by this administration. The Fiscal Bureau issued a memo this week that said by taking all of these items out of the budget, what the Joint Finance Committee is actually doing is punching about a $1.4 billion hole in this budget. Let's take a quick run through of some of the healthcare related items that were pulled from this budget. And it's quite extensive, so we're just going to hit on a couple of them. We will put a link up where you can see the extent of that memo and what provisions were eliminated across the agencies, not just the Department of Health Services and other health areas. Things like prescription drug co-payments, childless adult demonstration projects to add more people to Badger Care Plus, the repeal of the Health Savings Account program, a joint finance review for federal waivers, Medicaid Services Administration, family planning block grants, the repeal of the food share child support and paternity compliance requirements, and health insurance issuance and coverage requirements. A sampling, but there's a lot more. Like we said, 131 items in total. Joint Finance Committee will continue to meet and discuss this. In all, the budget will finally make its way through both houses. Governor Evers does have veto power. It is then a question of whether or not his veto can be overridden by this legislature. This is not the end of the story on the budget. A lot of these items could be resurrected as independent bills, and we will keep you posted on that process as it moves through our Wisconsin legislature back to Governor Evers' desks. Like we said in the description below, you can click on that memo and you can see the items that the Joint Finance Committee has crossed out of Governor Evers' priorities. If you have a question on the process, on the budget of the priorities of this state, you can send us an email and you can find us at healthwatchwisconsin.org.